Uh, Rishika, is the recording on?
Yes, I just started recording.
Happy, happy the job I have.
Recording started the live stream.
Happy.
Okay. And is it live right now?
Yes, yes. We are live.
Yes.
Sharing my
So,
screen.
okay.
Awesome.
So should we start with the session?
Let's wait 5 minutes and then we can start.
Yeah, we have to wait.
Yes, sir.
Welcome everybody who has been joined today. I think so. We have to start our schedule already. We are 8-10 minutes late today.
Good evening,
Uh,
sir.
Thank you. Uh, we are continuation in the pure of hip joints examination and then treatment. Am I right, Nikhil?
Yes, sir. Absolutely.
Okay, thanks. So I'll pray Dhanvantari as he is the father of medicine, father of surgery, Lord Sushrita, and ज्ञान देवी सरस्वती देवी को नमस्कार करते हुए आज का हम ये विषय शुरू करते हैं। इसमें जैसे हम मानते हैं कि हम लोग जो थैंकफुल है हमारे माता पिता को जिन्होंने हमारे लिए बहुत कुछ सेक्रीफाइस किया, हमारे टीचर्स, मेंटर्स एंड देयर गाइडेंस एज वेल एज माय कलीग्स and the other who has been supported us, and I am always been praying for my patient who has allowed me to do anything on their body. Today what I am here because of them. So now Vakshana Sandhigata Vata, this is the word, and in modern we know as an hip disorders. Today's lectures will be continuation in the clinical examination in OPD radiology. And next Tuesday, we are going to treatment about and we will be continued with our series. So now what is the most important is that for the physician and the surgeon is to be that clinical examination. Without that, if you do it, I don't think so you will be very good physician or a surgeon. So what we have to see is that आयुर्वेदा अपने वहां पर त्रिविध परीक्षा बताई है, उसमें दर्शन है, स्पर्शन है, तो उसी हिसाब से अपने को इंस्पेक्शन इन पल्पिटेशंस करना है एंड रेंज ऑफ मोशन जो है वो देखना है कि वो कैसे है, तो कोई फ्लेक्शन है, एक्सटेंशन है, एबडक्शन है, एडक्शन है, इंटरनल रोटेशंस है एंड एक्सटर्नल रोटेशंस है। फोर स्पेशल टेस्ट, four special tests is the main ones, how you can be examine them. And there are a lot of another tests that is known as the triangular test, then the Thomas test and fiber test, known as a particle test, headed test, long roll test, and this is the Alice test. This is one of the best tests you should have to learn this, and August test. These are number of this. Then I can send in a steam chiefly test, then sport test, main functional test, then gait examination, and scurating test, and single leg stance test. So these are a number of the things. If you don't this one, if you don't this one, then it will be the tension. Now inspection, you should have to move this, this, you can see that how it goes. It work or not work. So in this case, we are going to be inspection. And in main most important hip examination tests are ROM is the range of motion. There should be flexion, extension, adduction and abductions and rotation. Now gait analysis. So how we walk, and how is, the hip is been there that observe you have to allow to patient to walk them. So you can understand that if there is an abnormalities is there or not. Then the feather flexions, internal rotations. You just have to take up the legs, hold the knee, and then you move the rotations from the hip. So this one is also very good where the pain is there, patient is happy or not. And fourth one is an Partik's test known as a Faber test, flexion, the short form of everything. This is known as a flexion, adduction, external rotation for SI joint. You can see in the pictures that, how you have to do this examination in a supine positions, and you should have to take leg, fold it, and then you have to move the hip joints. So this is when you have to see need there. Then the score test is assessing the articular labrum and hip joints integrity. So when you know the leg, you put the leg outside and you should have to movement over there and assessment कीजिए कि ये कैसे होगा. तो वो आपको जो है वो आपको आपका मसल्स कितने मजबूत है, ओनली मसल्स है कि और कुछ भी इसमें इन्वॉल्वमेंट है, उसके बारे में आपको थोड़ा सा जानकारी मिलेगी. देन Tendinitis test, it has been assessing the gluteal medius weakness. So the patient is standing and then said one hip is been upsides and one is lower sides. So at that time, we can also think about that, which is in a weakness of the muscles or lumbar spine, or the another one is, your hip is not in a proper shape. Then Thomas test is assessing hip flexors, contractions, leg up, then you release up. So then you can sit, understand them. And August test is assessing equilibrium band. ITB is known as a tighteningness. You just have to lift up and see the hip joints with your hand that there is a tightness is there or not. Now the postures, this has been known as an understand that how the pain is going on. So if within a good postures, you straight over there. But some of like me patients who have been not been trained, they will have an the like an कुंद निकाल के हम चलते हैं. वहां पर that pain is got the short and thigh tight रहती है. तो वो भी आपको जो ध्यान में रखना चाहिए. तो these are the one of the cause over here. Now what we have seen another one, but then you can here see the muscles wasting. I will not repeat what we have done, range of motions and gait and everything, but I'll come out over here is the limb length discrimination. So that is been in the comparison of the true versus the apparent length. कहीं कभी कभी आपको जो है इसमें लेंथ के अंदर में शॉर्टनेस मिलती है कंजेनाइटल, तो वो भी जो है पेन का एक कारण होती है. और उस समय में आपको ये ध्यान में रखना चाहिए, मेजर कैसे करना वो बहुत ही जरूरी है, और ये आपको रख के उसको ऊपर काम करना चाहिए. Then pelvic tight postures. So you can ever see this in a bad postures. It is been anterior, posterior, tilt, scoliosis, and spinal alignments. So these are the things where the hip joint is also involved with all these conditions. And muscle wastings. So the muscles wasting is, you can finalize is a gluteal and coordinates, synapse of atrophy, chronic diseases, and there should be a compression of the nerves. You can have seen over that something is a swelling is there. It may be hernia, it may be anything else. So that also you should have to find out if this deformity can get any disease or not. And obstruction while walking, sitting, and another fluctuations. Then the fixed fluctuation deformity. It is fixed only. Then heal the surgical replacement. तो वहां पर जो है आपने कोई हिप रिप्लेसमेंट कराया है या कुछ और स्पाइनल सर्जरी हुई है, तो ऐसी अवस्था में आपको जो है वो डिफॉर्मिटी मिलेगी. And then you should be find out with a clinical examination. There should be a scar, or otherwise you should have a better history. In this course, then Thomas observes is a high level of test. These are been very cleanly you should have to learn in that one, and then it will be helpful to us to what to do and what to not do. So a high level test, this is in a summarized, shallow linking to linking further detail. So the additional tests are is the score, Tendergrass, Thomas Observes, and Howard Moore. Now palpitations allows clinical to pinpoint the exact site of point tenderness such as the greater trocar or joint line, which is critical for a distinguishing between the condition like trochanteric bursitis and tendinopathy or a referred pain. In this condition, palpation is must, and you should have to find out wall is on the proper place or not, or there is a pain or there is some swelling. So now palpation of hip joints, you should be appreciate this in the anterior superior iliac spine palpitations. You can see on this, you can appreciate this, and then you should be final out if that the whether it's painful, not painful, and you can find out other things. And iliac create palpitations. You can see over here, your hand is should be here, and you palpitations, and you can wait to the gluteal muscles attach. And the greater tropular, this one you can see over here that how you have put the hands, so you can understand the bones. Bursa means there is anything, the bust of the muscles or anything that you can find out with the pains and palpitations. And this is in the pubic symphysis palpitations. This is the most important, particularly in females, where there is a functional disorders of the pelvic bone over there. So that is known as adductor origin. Then ischal tuberosity palpitations. You should have to put a finger over here as well as you can put your hand on the bone. So then this shows the muscles origin or not. Then femoral pulse palpitations. So here you can get a palpitation or not, and the muscles are smooth, not hard, and there is no pain. So then another one is tenderness assess. This has been assessment. So you can see that your hand is should be there. There should be middle and lateral. These three tenderness you can find out where there is anything or not. Then the most important thing is there is a temperature assessment. If the area is hot or not. So this type of examinations is been most necessary. At that time, you should have to note down or otherwise remember what you will get over here. Then the range of motions. You have seen in the last lecture of Dr. Nikhil Gupta, he has been shown over that you should have to see hip joints, knee and ankle joints are done freely with pain or without pain. Then you can change it. It won't, the anterior side. Yes. So that's you have to learn it, and you have to, the masters in this how, and your observation should be there if there is everything is normal or not. Then hip examination is circular because accurate clinical assessment, localized pathology early, and differentiates is hip from spine or a sacroiliac cause, and guides correct diagnosis, imaging, and the treatment. So why should we do the examination? It should be find out that it's only this in a hip joint, not along with the spine or any the any other the anatomical structure is involved. This is the most important. So you should have to must learn this clinical examinations. So now you should have to pay the inability to keep the legs up. We I like to see it again, the different position, whether he can hold or not. And you can see this is a positive test. He cannot hold. I feeling that he going to be the fell, and he may not be. Then you can able to walk. You can see the hip movement. I will show it again. Is it possible or not? Can lift leg and keep pelvis? Is it possible or not? Is painful or not? So it is a positive test. Then you allowed him to the, this is negative. Without pain, he can up. And here you can see that the patient is of the movements and assessment that how everything is going on. So this is in a fever test, known as in a particle test, Petri test. So here you can see this video. This is known as the FIDE test. You do it carefully, otherwise you can increase the pain. So the other than the another test is in a log roll test. I would like to repeat again how we slowly with this and ask the patient whether he get a pain or not. This is known as in a Galeazzi test and like in a ELISE test. In this test, what you have to do, so this is in an over test. This is known as a score test. In this case, you should have to hold with this, the band this knee, and then give the pressure to the hip and move the movement. And you should have to note that where is the pain, at which level, and what is the pressure. So it is known as a score test. So now this is known as a gait examination is an abnormal gait patient in hip disorders. Here is this is known as an antenna cat. So where you can see over here, the pathology is in the hip joints. Now this is the tendal exhibited gait. So you can see over here, this is the pain is on the trocar. Let's go back. This one is been in the wedding gate. So here, both the way you will get a pain. This is different name, and this is the circulation gate. So here you can have a knee pain when you go up and back, and then this is the high stepping gate. Some people, has to be in a very staircase up, or you do an exercise and you will get a pain. So these are known as the gait examinations of the movement, and you should learn it, and you should have to ask the patients. Now this is a squatting test. Will it possible or not? Difficult tasks in an old age or a known patient who have not been athletic or doing the regular exercise. It is a painful. So now single leg test. This is the most one. You should have a two angle over here. You have a balance and you have a control on your legs as well as the nervous systems and good coordination with your brain. So now this is in radiology. This is the most informative videos. All this made by the Nikhil. Download and created more fee because he is traveling to for the camp. So now this is what we are seeing over here is the hip joints, bone, and the other anatomy. In the radiology, if you want to just you can so this is here. You can get an osteophytes. Then joint space is narrowing. This one. Then subcaudal sclerosis. Then again, this one has there is a subcyst. These are the most common radiological uh, findings are being made by the radiologist and they can guide something about us. So now comparison of ultrasound. Then in the radiographic intraoperative finding serve the hip osteoarthritis. So this is that, this USG show over here. And this is, you can say that this is totally hip replacement, the picture. Then this you can get an osteoarthritis over here. And because of the weakness, it break down and you should have to replace it. So that is the role of ultrasound also. And the most common we get is in the practice is, the avascular necrosis disease of the femoral head. So this one, you can see, this is known absolutely normal. And here, bone is necrosed, hip joint is irregular. This has been very bad cases what we get in a practice. Here the blood supply has been cut down and the muscles and bones start the necrosis and they become disturbed and there is difficulty in the pain. There are in the last stage there is a hip replacement operation, but it come in an early stage and with the lifestyle improvement we have a very good result in these cases. So now tricuspid bursitis, you can oversee over here. Prototracheal bursitis, there have been, there is some swelling, it's tear. Next, we will get, the tear, muscles tear and everything. So this has been, you can say that AFI is the pulmonotocular imaging. AFI is condition where extra bone grows on the hip bone. You can see over here, this has been extra growth. This is then one another diseases over here and causing them to rub against each other during movement. They, they get a crush is together while this. So this has been very good. The MRI over here, you can get a liner structures, fractures over here. You can get a space over here. And then it will be while the movement, the different, it rush with the bone, very painful condition, and it create a lot of headaches. Hip labral tear. You can see over here, this muscle is become tear. So now septic arthritis of the hip joints. Very rare, but it nowadays is seen, This arthritis is because of the causes is uh, coagulopathy. You will get a septicemia over here. So this is transient synovitis. It's seen in, the toxic synovitis is a common self-limiting inflammation of the hip joint in young children, typically age 3 to 8, causing hip pain and limping often after a viral infection. That is also, you should be seen and understand this type of the patients and the examination. MRI images of 7-year-old boy with transient synovitis of the hip joints. These all are synovitis. These are the fluids you can see over here, and this will be helpful to treat the patients. Now, developmental dysplasia of the hip. So this is the patients, asymptomatically skin fold in the child with DDH, then leg length deformity, which we have discussed previously in a child with DDH, and the last one is the restricted hip uh, abduction in the child with DDH. So then these are the development child, you should have to find out this. And slipped capital femoral epiphysis. This is known as a sheath. This is the pelvis. Hips. This one is here. This hip is socket, and slip femoral head. So a common hip condition in the adolescent where the growth plate physics weakness causing the ball of the hip joint, femoral head, to slip backwards from the thigh bone femur. So पेशेंट के हिप जो है पीछे अच्छी तरह से नहीं जाती है, अपना एबडक्शन नहीं होता है, तो उस टाइप की भी बीमारी आपको देखने को मिलती है. And one is very common nowadays is the tubercular arthritis of the hip joint. That you will get by MRI and X-ray also. Very good X-ray is it will be there, you will find out. Then traumatic hips. This has been, you can see over here, this is the trauma and bone has been fractured or some swelling over there. So now this is the disclaimer. We have been very good, thankful to the whole multimedia AI generation as well as the teacher who has been put these pictures and videos to us and non uh, commercial use for the evidence to learn this one. We are thankful to them and we are grateful to their have made these lectures easy. So I'm Dr. Sangvi, you know it better. This is Nikhil Gupta who has made this, and now the platform is open for the discussion. Nikhil, are you there?
Yes, sir. Yes, sir. Let
So
you.
you take the continuation of the question answer.
Yes, sir. Thank you so much. If anyone has any questions, they can put the questions in the chat box. We are ready for the question session, question answer. Sir, I had one question.
Yes, you
Hello.
can go ahead with the question. Yes, I'm listening you.
Yes, sir. The radiology has come since this 10 to 15 years, and the advancement in orthopedic surgeries, basically hip replacement and nailing, plating, screw, uh, this have been done in this recent 1 or 2 decades. What was your experience 20, 30, 40 years ago?
See,
What
at
was the
that time,
scenario?
when there was a no MRI CT scan, we just taken up a clinical examination is more. Number one, they are physician, they are not evidence based. Second thing is that, and the observations of radiological knowledge by the radiologist as well as the surgeon was very good. My brother, he has been operated by Dr. K.T. Dholakya before 30 years back, hip joints.
Yes, yes, sir.
And
Yes, sir.
there was no MRI. And still he is happy. But after a few years, I think so more than 15 years, his assistant has operated him, but he's not happy with the second time. So
Okay.
why I am emphasizing over here, clinical
Hmm.
examination is always better, evidence based to support our diagnosis and improve our confidence that it should be there. And now there are the portable MRIs available, very rare in the world,
Yes,
but
sir.
still they are available in the operation theater, and you can be find out with the correction that it is done excellently. But still, I'll tell you that if your clinical assessment is not good, then it has been
Yes,
very,
sir.
very difficult to use the modern diagnostic weapon. That is my personal view.
Yes, sir.
I don't say it is not necessary, I'll tell you. But you should be very accurate about your clinical judgment. I have seen
Absolutely, sir.
I have seen today one patient,
Yes,
in
sir.
you can say that, Badlapur. She
Yes,
has a
sir.
full down view of the history. She has a trauma. She has fractures. She has the muscular tear, and he advised for the physiotherapy. So the clinical
Okay.
assessment is excellent. Now, any other question? I think so. We are only three people today.
Yes, sir. Nothing, sir. I was just curious that how the doctors or surgeons used to do 20 years ago when there was no advancement. So this will be a
See,
very great information for the
right,
upcoming surgeons.
right. See, what I'm saying is that, I always been better than that. I am maybe in favor of more modern investigation should be there. Evidence based should be there. But before that, you are clinically what you want to see in the patient and how you do the correction. That is more important.
Yes, sir.
Today we are seeing that there is no, the clinical assessment mastery. We are always believing on the CPA, evidence based and everything. And the patient is became negligent, the miserably, the living with the pain.
As the number of cases patients has rise, so doctors has also rise. Your answer is this.
I say that the Google information is not a final information. Number one, you
Yes,
should
sir.
have to learn it, you should have to make a practice, and you should find out your own assessment as from the doctor side. And they have to learn radiology also and other investigation. In these cases, we have missed, the nerve conduction studies and everything because it's beyond our mind. as an
Yes,
Ayurvedic
sir.
person. So we have not taken, you have not taken it well. But these are the limitations is there. So from the doctors, it is also there, as well as the patient is also there. Patient is more becoming informative, but they are not
Hmm.
come to the conclusion and they become in a problem. Or otherwise, they are super smart, they come with the clinic. See, sir, this is the new one is been at today night. I hope so you have not understand. So this type of the quackery is going on. So I said that the time will come, it will be solved by AI and the robotic information and diagnostic. But still, man is man, and without that, nothing is happen.
Yes, sir. Absolutely.
Any more question is there?
Nothing much, sir. Only this much for today.
चलिए तो वी शुड हैव टू क्लोज ओवर हियर. जो कोई भी
Yes, sir.
ज्वाइंट
Yes, sir.
हुआ है, जो कुछ भी हुआ यहाँ से, उसके लिए आप सब लोगों का आभारी है. आप लोग सुखायु भव, ऐसी मैं शुभकामना करता हूँ. एंड अगले मंगलवार को इसकी ट्रीटमेंट के लिए हम बात करेंगे, जिसमें मग्नि कर्म, वित्त कर्म, मर्म चिकित्सा और इत्यादि के बारे में हम बात करेंगे. थैंक यू वेरी मच. गुड
Thank
नाइट,
you so
टेक
much, sir,
केयर.
for today's lecture.
थैंक यू. थैंक यू.
Thank you so much, sir. Good night, Shubhra.